Community has been our home forever, Community East. Community Health Network is a marvelous organization, wonderful company, or however you put it. I think they're very loving, very caring. Everybody connected with the hospital. My name is Marion Dennis. I've had both knees replaced, the most recent at Community East. Oh, Dr. Todderud, he's wonderful. He's, in fact, I'm probably gonna have to have a shoulder worked on, and I know I'm gonna go back to him. He did my mom's knee back in 1989, so I suppose that's another reason I would have thought of him. But he's just very good. In fact, the therapist here that I went to after my surgery for therapy said he's always glad when it's a Dr. Todderud patient because he knows the knee has been placed properly and will be easier to work with. I went in, I believe it was August, and he said we could do it then the first part of October, which I thought was great. Went to the hospital, and he said, well, now instead of 3 days in, which a year and a half ago had been 3 days, it's 2 days. And I'm thinking, oh my goodness, 2 days and I'm supposed to come home and be fine. And I was. I couldn't believe it. Then I had intensive therapy in the house for 14 days afterward, which is really the way to do it, to get started really good. Then I had therapy here at the Pavilion with Andrew, who is magnificent.
My name is Andrew McClure. I'm a physical therapist with Community Health Network. I work here at the Washington Pavilion. Marion had had her right knee done about a year ago and was ready for her left side to be done this time. She had had home therapy for a few weeks and had done really well with that. Her motion, I think she came to us 3 or 4 weeks out from the surgery. Her motion, she already had achieved a lot of her motion goals, which was really helpful for our purposes in getting her through the program quickly and getting her better. She was a very easy personality to work with. She really involved in her therapy, was really good about doing her exercises at home, which makes a huge difference. Marion has 2 steps from her garage into the rest of her house and no handrail there. One of the big goals for her, as we talked at the beginning of therapy, was she wanted to be able to go in and out of the house without having to hold on to the wall or hold on to her husband or whatever, and even get to the point where she could hold groceries going in and out. So that was only 2 steps, but a pretty big hurdle for her that she needed to be able to do. So as her range of motion and her strength got better, that she was able to do them within a few weeks, which was really nice for her, and I know she was happy about that.
Well, the guidebook is good. It tells you, when you go back, you can look and see where you're supposed to be at a certain point. You think, oh, okay, I think I'm there, or I'm pretty close to it at least. The exercises in there were wonderful. Again, they had changed from a year and a half before, and they were better. I was more prepared, quicker recovery, quicker to get movement, and be feeling like I could do things. If I'd known how great this one was going to be, I probably would have done it at least several years sooner. This knee replacement was wonderful. It went so well, I couldn't believe it. Everything was as it should have been and better.